The U.S. has administered 200 million doses of the coronavirus vaccine within President Biden's first 100 days in office. That's double the administration's original goal. The president acknowledged the milestone on Wednesday. During remarks earlier, he said the vaccine is now available at nearly 40,000 pharmacies nationwide. Mr. Biden also noted a large reduction in deaths for those older than 65, and he announced a new incentive for employers to make it easier for their workers to get a shot.
One concern I've heard from so many Americans is that they can't afford to take the time off to get vaccinated or lose a day's work because they are feeling slightly under the weather after the shot. So today, I'm announcing a program to address that issue nationwide. I'm calling on every employer, large and small, in every state to give employees the time off they need with pay to get vaccinated, and any time they need with pay to recover if they're feeling under the weather after the shot.
President Biden said the IRS will provide instructions for how employers can get reimbursed through a tax credit. Dr. Cameron Webb is Senior Policy Advisor to the Biden administration for COVID equity. Dr. Webb, thank you so much for being here with us. I appreciate your time. A Monmouth University poll released last week found roughly 1 in 5 adults in the U.S. say they're unlikely to get vaccinated. Is that the biggest hurdle the White House faces at this point in trying to get the nation vaccinated?
Well, first off, thanks for having me. I wouldn't necessarily say that 1 in 5 is the biggest hurdle. I think the biggest hurdle is the ongoing necessity to make sure that vaccine access is there, that everyone has access to vaccines, that we have enough vaccinators to put those shots in arms, that we have enough venues for vaccines. And so I think that continues to be the goal. What we found is that when you have vaccine access and then you get the right information on the safety and the efficacy of these vaccines, that vaccine confidence really increases, especially when you get that information to trusted messengers. And so we expect that we'll keep getting that information to trusted messengers in all these communities, and we might be able to move the needle on that last 20%.
And in addition to vaccines, what progress is being made on potential treatments for those infected with COVID-19?
Well, I think on the treatment front, there's been a tremendous amount of progress. I think we've seen, the National Institutes of Health have recommended these monoclonal antibodies, two in particular, that have shown just tremendous potential in the way that they're preventing hospitalizations and preventing deaths in folks who have mild and those monoclonal antibodies are another one of the examples of opportunities that you have if you do get COVID. So yes, the vaccines are kind of the shot of hope, but I call the therapeutics the shot of help for individuals if they do actually get COVID-19. And so there's plenty out there, and we're continuing to support and trying to drive forward scientific research because again, we want all paths open to get us through this pandemic.
I still think there are probably lots of questions about the J&J vaccine. Of course, earlier this month, the FDA advised states to put a pause on the use of Johnson & Johnson's vaccine due to concerns over very rare cases of blood clots. A similar pause happened with AstraZeneca's vaccine in Europe. That vaccine, of course, has not been approved yet here for use in the U.S. But will we see either of those vaccines come online anytime soon?
Well, I think, the first thing is the Advisory Committee on Immunization Practices revisiting Johnson & Johnson again later this week. And so they'll be looking through the data, looking through the evidence, and they'll give us their best assessment of when and how we can safely make sure that that shot is available to people. The key here was the safety of the American people. That's always been the priority. And even though it was, 6 incidents of this cerebral venous sinus thrombosis with thrombocytopenia, so low platelets and some clotting. There's only 6 instances out of 7 million shots. It still stands to reason that for us, the better part of valor was focusing on safety and making sure we spend the time to make sure that we know what's going on. And so, I think that we'll make sure that when that vaccine, if it becomes available again, it's in a setting of having good safety information, good guidance to providers and to individuals, and a really clear path forward.
And some aides to governors were concerned earlier that the pause in the J&J vaccine might lead to more vaccine hesitancy. Did you see any implications from that? Did you see any evidence of that?
Yeah, I think we have seen, I think if people hear only that the vaccine was paused because of some adverse events, then that can lead to some increased hesitancy. But what we found is that when people actually heard that there were 6 instances in 7 million shots, and yet the government paused the vaccine anyway, it actually inspired some confidence in our approach and in our emphasis on safety. And so, there are polls suggesting that as well. So I think a lot of people are seeing that as a really clear sign that this administration is focusing on safety in this vaccination effort. But I think we have to continue to get good information out there. We have to be clear in how we're communicating what that decision was driven by. And I think if and when Johnson & Johnson comes back online, we have to be really clear about what we found and why we still feel like it's a safe vaccine for folks.
And with this news today reaching 200 million shots in arms, I'm wondering, what are the next big targets for this administration when it comes to the vaccine?
It's continuing to push forward. We're at north of 50% of adults who have received at least 1 shot of this vaccine, over a third who've received, at least 2 shots or who are fully vaccinated. That's a big deal, but it's not enough to stop this pandemic in its tracks. So we still have more work to do. I would say that first 50% is going to be the more eager 50%. We still have to work really hard to close the gap and get the last adults in this country vaccinated, start vaccinating young folks. So there are a lot of additional hills to climb, but we've shown that we're equal to the task. This is more than just a whole of government effort. It's a whole of nation effort. The American people have stepped up, rolled up their sleeves, and are getting vaccinated. And we're excited, and we hope that they'll continue to do so that we can end this pandemic.
And Dr. Webb, I'm sure a lot of viewers are noticing the weather changing around us. We're approaching summer season. People are probably eager to start making some plans. Are there any dates that people should start circling on their calendars, a return to normalcy that they should maybe look forward to? Anything that you could tell us in that regard?
Well, if this pandemic has taught me anything, it's that I should throw away my crystal ball. But what I'll say is, the president has looked at the 4th of July as a date that he really wanted us to focus on, and we're continuing to focus on making sure that we're aiming. But it's not looking at that end date and keeping just that in mind. It's really focusing on the task that's in front of us and staying disciplined. And so what I tell people is that date when we're opening things back up and getting back to a semblance of normalcy, that's driven completely by we the people, right? It's driven completely by the decisions we make, the decisions to wear a mask, to maintain physical distance, to wash our hands, and to get vaccinated when it's our turn. And if we do those things, that date will come faster than if we don't do those things. And then every community, people are making those decisions today, and they're going to live by the impact of those decisions tomorrow.
All right, we'll keep an eye on some of those dates coming up. Dr. Cameron Webb, thank you so much for your time today.